there's a lot of misconception on MAT. MAT stands for medication assisted treatment. So the key part of that first is treatment. Now, what is treatment? Treatment, medication is not going to be everything. It's going to have a major role. It's assisting the treatment. Treatment means the counseling, lifestyle changes, everything else you can do, treating the underlying psychiatric condition. But how do you do that if you can't think about anything outside of what you're experiencing right in that moment, which is extreme distress? Your brain is crying out for a substance, and if it doesn't have it, you're physically ill. So, and you can't really stop that cycle until you quiet your brain down first. If somebody's using high amounts of an opiate pill, or they're using heroin, any sort of large amount of opiate, it takes a lot of effort to secure that. It impacts your life in a very negative way. So it's hard to just wean off of that on your own. So how do we get control again, right? So the first is your brain has those opiate receptors, and specifically the mu receptor in the brain. That's the one that is the target for all the medications we used in MAT. So the top two are buprenorphine, which a lot of people would know in different brand names like Suboxone or Zubsolv, but the key ingredient there is buprenorphine, and the other is methadone. And they both work very differently, but their role in this is to basically occupy that mu receptor, which once it's occupied, your body is not in withdrawal. You're no longer really physically ill in that moment. You settle it all down, then you can regain control of your life and actually participate in all the treatment part of it. The real hard work then comes after that. Now you're on a medication, let's say methadone or buprenorphine. You have control of your withdrawals. You're not in withdrawal. You're not craving the medication as much because your brain has that receptor site occupied now. And then you can focus on treatment with group therapy, counseling, lifestyle changes. They're very different in what they do. So they have a very safe, a very safe approach to that receptor compared to something like fentanyl or heroin or even hydrocodone or oxycodone. All those things I just mentioned are very potent at that receptor. So they're strong mu activators, opiate receptor activators. The more you activate the receptor, the more your breathing slows down. That's one problem with activating that too much. That's why we see so many overdose deaths from when some people are using fentanyl, especially fentanyl is the most potent, heroin. Anything that really activates that will slow your brain and your breathing down.